But, Doctor, if you don't have a pre-existing condition, what are the percentages of 20, 30, and 40-year-olds that have died from COVID-19? It's minuscule. Why in this article was I given the impression that that many people are succumbing, young people are succumbing to this disease in the worst possible way?
Well, look, we don't know what the denominator is right now. We're measuring infections, symptomatic infections. I think we're vastly underestimating the level of Delta spread right now because I think people who are vaccinated, who might develop some mild symptoms and might develop a breakthrough case, by and large, aren't going out and getting tested. If you've been vaccinated and you develop a mild cold right now, you don't think you have COVID. And people, younger people who are the ones who are getting infected are also going to be less inclined to go out and get tested for COVID. We're not doing a lot of routine screening unless you play for the New York Yankees. So I think we're not picking up a lot of infection. I think our ascertainment probably is very low right now, not because we're not doing testing, but because people who are likely to get infected are unlikely to go out and get tested because they don't think they're infected. They're either young and healthy people or they're people who've been vaccinated. So we don't know the denominator. I suspect that there's a lot of young people right now getting infected, and what you're seeing is the tip of the iceberg getting hospitalized and getting very sick.
Scott, is that an argument for changing our behaviors if you have somebody who's vulnerable? Is that an argument for making sure you get your kids tested before you take them around your parents or something along those lines?
Look, I think that's what we should be doing right now. Rather than implementing mandates on entire populations, I think we need to look at how we protect the vulnerable. And if you're one of those vulnerable people, take precautions. Even if you've been vaccinated, if you're older, you were vaccinated last December, you might have some declining effectiveness from the vaccine, you're immunocompromised. Wearing a mask right now for a period of a month, 6 weeks, is not imprudent. I think especially if you're in a portion of the country where prevalence is high. You don't need to do it in Connecticut, where prevalence is very low, vaccination rates are very high. But if you're in Mississippi or Arkansas, Nevada, places where there's a lot of infection, I think you need to think about how to protect yourself. Los Angeles County as well. It's not as dense in Los Angeles County as other parts of the country right now. They do have, a surge of infection, but it's not nearly on the same scale as what we're seeing in some other parts of the rural South.
Scott, let me ask you one more question. You keep coming back to this idea that we don't entirely know how long the immunity is going to last or how long protection will last. Let's not say immunity because there are other levels just besides reading the antibodies in your blood. It occurs to me that the people that we vaccinated first are all the healthcare workers, and they're on the front lines once again. Are they the canary in the coal mine in this situation? If we're not doing a third booster shot, if we're not going to know otherwise, we're not following up with what Israel's doing, is the clue going to be when healthcare workers start getting really sick because they were the first one vaccinated?
Well, first of all, I think we're going to end up boosting a portion of the population. I think the canary in the coal mine, unfortunately, is going to be the nursing homes. In December, we vaccinated the healthcare workers and the 1.34 million residents of nursing homes in this country. I think the vulnerable elderly in nursing homes, when you see these dense outbreaks in parts of the South, the infection's eventually going to get into those settings. And just like you see the virus shoot around a baseball team in a close quarters, it's going to shoot around a facility like that. And there's going to be some elderly who are vaccinated who are still going to be vulnerable, either because they're still vulnerable or declining effectiveness of the vaccine. I think the healthcare workers are an interesting question because the question is if you're a 55-year-old healthcare worker going back into the hospital in the fall, the winter, amidst surging infection from the Delta variant or the tail end of this wave of infection, do you feel comfortable? And, what could end up ultimately pushing the CDC to make a recommendation here may be the healthcare workers wanting to get boosters. I know some doctors have already done it, and I think the government really needs to speak to this because what you don't want is lose your relevancy as a public health institution. You don't want people taking matters into their own hands. You want to be able to give guidance that people could follow. So if the CDC is very late to issue guidance, I think you're going to see some healthcare workers start to contemplate a booster for themselves. And it could be after the third dose, you get a very durable immunity. We don't know.
Scott, just to cut to the chase, is there going to be a big fall spike in a COVID 2.0, or are we approaching herd immunity where we've got this under control? What do you really think?
Well, barring a new variant that pierces the vaccines or pierces the immunity offered by prior infection, I think after we get through this wave, we're going to have enough of the population with a wall of immunity that the level of spread is going to drop dramatically. It's not going to be quite herd immunity. I don't think we ever get herd immunity. This becomes endemic, but it doesn't transfer with the same velocity. I think this is the last surge of infection we're likely to have to deal with. We thought B117 was that surge. We didn't anticipate Delta. Delta is so much more contagious that it's going to require more of the population to have immunity to finally put this to rest.
People are still saying that the hesitancy that some have is because it's not fully approved. You described that the application isn't complete yet, and it's a rolling application where they're still collecting data from certain subgroups before you get to full approval. When do you expect full approval? And I don't really know whether that's why people aren't getting it. Do you think more people would get it if there was full approval? There's a conspiracy theories that say, look, they haven't approved this because, they know something, and I don't think that's what it is. But, that's the stigma. Yeah,
the full application's in now. So at least with Pfizer, I can't speak to Moderna, but it is in right now. I think Pfizer submitted the application originally May 21st. I always predicted, I've said many times, I think it's going to take the FDA 3 months to approve the applications from the time of first submission. I think that's a reasonable timeline. It might slip a couple of weeks. It might slip into early September. But I think the timeline of 3 months from the receipt of the initial application is what FDA is working on, in my view, given my experience at the agency. So I think this is coming up. In terms of what it's going to drive, I think on the margin, it probably will drive more confidence about getting vaccinated. There probably are people for whom they're deterred from getting vaccinated because it's not fully approved. But I think more likely what's going to happen is it's going to give healthcare institutions and other employers more impetus to mandate vaccination. Once it's no longer perceived as under an emergency use authorization, I think a lot of businesses, a lot of healthcare settings are going to mandate vaccination going into the fall.
Shepard Smith here. Thanks for watching CNBC on YouTube.